Good morning. Welcome. Thank you for coming to today's Ethics Roundtable. Our guest speaker today is Dr. Kathy Prue-Owens. She's a retired Army Nurse Corps officer who served in the United States Army for over 30 years. Her specialties include cardiovascular, critical care, burn care, nursing research, and administration. Prior to joining the University of Colorado Springs College of Nursing, Kathy practiced extensively in the clinical setting and served as a medical surgical nursing consultant to the Army Surgeon General. As an assistant professor at UCCS, she has provided clinical, educational, research, and cultural expertise to the university, community, and national organizations. Kathy teaches undergraduate and graduate level nursing research courses that include ethics. She is currently active in professional nursing organizations with an appointment to the board of directors for the Colorado Center for Nursing Excellence and the board of directors for the Colorado Healthcare Ethics Forum. Kathy recently became the president-elect for the Colorado Healthcare Ethics Forum.
Okay, good morning or almost afternoon to everybody. So my name is Kathy Prue-Owens. I'm an assistant professor in the College of Nursing. And I want to be able to, first of all, thank those who are online too, and you guys who came today. My topic today is going to be about ethics engagement as a professional obligation. So I want you to think as we go through this presentation, is ethics engagement a professional obligation from the perspective of wherever you serve, if it's in finance, business, if you're nursing students, your instructors, maybe you're a PR person, but just put that in the back of your mind and think about, is it a professional obligation that we get involved in ethics as professionals, wherever we're coming from? So, all right. So what I'm going to do today is I want to take this presentation from sort of three perspectives. And one is this whole idea that I call my moral inspiration. And I'm going to share with you the state of nursing. I'm going to share with you also a nurse's experience with COVID study that I participated in with the local community. And I'm also going to share with you how all of these, plus this academic as an influencer in a nursing graduate school, how all of these really kind of shaped and redefined how I thought about ethics. So you can imagine that being in the military for 30 years, the whole piece of the ethics, coming into the university setting, being in a profession that's one of the most trusted professions, and having all of these dynamics influence my thought process. But for this presentation, I just want to share with you the introduction and then why I really got interested in wanting to look at being involved with the families and how I could shape my own courses and so forth. So when I give you this information, think about it from a perspective of your profession. Like if you're in business or in finance, how is my state? How's that state? And I'm just going to give you an example from the nursing perspective, but I think it has relevance to all our professions and where we're at today within our own professional trajectory. I'm also going to share with you the Daniels Fund Ethics Initiative Principles and how they apply to the nursing profession, and give you some perspectives from the students' view. And then I'll just give a summary of this presentation. Okay, so just a quick introduction: ethical engagement, building relationships through serving mutual interests, which should be a two-way street, recognizing the diversity of individuals and communities. So I want you to think about that. Not only do we bring our perspectives to ethical engagement, but even when we live within a community, we bring our perspectives to ethical engagement. So this definition that I'm giving you for this presentation really is based on an informal definition. But do we as professionals or citizens of our community, our country, and society have a professional obligation to engage in ethics? Okay, so think about that and think about how, even past this presentation today, how you can promote ethical engagement among students or yourself or colleagues, those that you even surround yourself with in the community. Okay, so my moral inspiration, let's begin with just what we know about the state of nursing, the nursing profession. Okay, and think of it from your perspective too, within your own profession. But here's just some information about the nursing profession. We're the largest healthcare organization. Okay, all licensed nurses, about 84% are employed within nursing. There's a projection of 203,000 new registered nurses, positions that are being created within this time frame, 2021. And we're actually comprised of the largest segment of the U.S. workforce among the highest paying large occupation. Okay, so we sometimes wonder if we really do get paid that good, but we're up there. And the nurses are primary providers of hospital patient care and delivery of most of the nation's long-term care. Yesterday or the day before, I actually get a lot of stuff from the nursing organization. And this little clip that came out was just something from nurse.com. It kind of gave another quick update. It talked about the nursing shortage. It talked about our online nursing programs and the threat to our online nursing programs if we don't enroll students and if we don't have the faculty to take on those programs. Traveling nursing is a big issue that has come up. Home health nursing is another big issue that has that's just within the last 48 hours that has really even added to the state of nursing. Employment of registered nurses is projected to be by 6%, and most health services involve some form of care by nurses. Okay, nurses operate independently. We don't operate under a license from the physician or any other discipline. We operate independently. With more than 3 nurses and RNs in the United States as physicians, more registered nurses today enter practice with a bachelor degree. Employees are expressing a strong preference for new nurses with bachelor preparation. And then findings from the American College of Nursing is that the survey employment of new graduates show that nearly 41% of employees require new hires to have a bachelor's degree. And then this in 2020, which is a little bit late here, is that registered nurses, 14.9% have a master's degree and 2.2% with a doctoral degree. So our educational level and our state of our practice has a lot of demands both educationally, both practice-wise, both knowledge. And so we have this combination. And then in the midst of all that is this ethical sort of cloud that is up there, right? That's really kind of hangers over our profession and how we carry out our profession and our practice. So ask yourself, do we have a professional obligation to get engaged in ethics in some fashion? In some fashion. It doesn't have to be, for me as a nurse, it doesn't have to be where you're at the bedside and you're like delivering that care, but it can be any realm of our lives that we live in some type of fashion. Should we engage in ethical engagement in ethics? So now what I want to do is just share with you this nurse's experience with COVID study. And I'm going to share this with you because this study actually brought up ethical issues among nurses within our community. So this is a study that was actually done both at Centura and UC Health. And I'll just share with you some slides on this, and you'll get the point with not only our state of our nursing practice and our profession, but now you have this study that's actually, we're actually pretty proud of this because we really feel that this study, the rigor of the study is probably really one of the few in nursing research that has taken place. So let me share with you. So this is a study that a part of the larger study, but support from within, mental health needs and deficits of nurses during COVID. So this was the Centura research team that I worked with, another nurse scientist, clinical nurses, clinical nurse specialists. Now, Kelly, who was a patient safety, she was actually an ICU nurse at the time. So this group of research team, we wanted to look at nurses' experience with COVID when they were preparing or cared for patients during the COVID time. So, a very challenging, very, I would say, complicated time in the nursing practice. So what we wanted to do, here's our research team. And I took some slides from a couple presentations that we've given, we actually presented the study in Scotland too. But the study was to look at the lived experiences of nurses who were caring or prepared to care. So we wanted to also take into consideration those nurses who were preparing to care for COVID patients, but never maybe even had a chance to. They did all the preparation, they worked on the unit, they worked on the ward or whatever, but maybe they didn't actually get to take care of those patients, but they were doing that preparation. But we wanted to look at the psychological impact of fear and uncertainty among nurses. So you're kind of thinking, well, how does this really relate to ethics? So when we're looking at the mental health and this whole fear, it does play into how we engage in ethics within the nursing practice or the nursing profession. So just to show you, at this time, there was all these different headlines coming out, right? Just bombarding the nursing profession, just to hear, American Heart, American Health, American Surgery, all these organizations bombarding about how we should, as a nursing profession, deliver nursing care. So you can see that lots of different entities were involved, and there was the point of maybe looking at well-being, but how do we do that in the midst of a pandemic? So a lot of information coming in at once. Do you think that can play into somebody's ethical decision, engaging in ethics? Yeah. So the areas that we wanted to look at in this study, this is just one slide. I'll show you the next one, but just to give you an idea of looking at the nurses and their lived experience, we looked at feelings, we looked at experiences, negative, positive. We looked at the impact on their personal health, their mental health, effect on their health behavior. Did we see nurses changing their health behavior, maybe exercising more, maybe drinking more, anything like that? Feelings about receiving the vaccine as a healthcare worker. So these were the areas that we were interested in. Feelings about nurses who were not working with COVID, suggestions for improving tools, emotional resources, communication, experiences with leadership, advice that you would give providers and staff, and then looking at how academia could help training new nurses. Okay, so these were all sort of the topic areas, and then we had questions that were relevant to these areas. We had 19 focus groups, and in this area with the mental health, these were the things that came out of the focus group related to just mental health. So the human cost is too much to bear, moral injury, relentless, emotional worn out, no resources, numbness, mental health. Here was a quote that came from these things. I would definitely say that mental health, it kind of gets sent to the sidelines because it's the last thing on the list. So my connection here and what I want to convey to you guys is that in the midst of mental health in a profession, and I don't think it really matters if it's other professions too, not just nursing, that you can have mental health be at the forefront that could potentially, and it really did in the cases with our nurses in the study, really influence ethical engagement. So what I wanted to concentrate on was this theme of moral injury, relentless. It had to do with the situation and the environment did not allow nurses to perform in alignment with ethical conduct or personal beliefs. So think about that from a perspective of where you're at in your profession and not being able to perform or align with ethical codes or even ethical principles like the Daniels one as what your foundation is for your ethical codes, right? And in this case, it's the nursing profession. Core values violated as nurses, lose-lose, you can't not win. These self-identified moral injury by subjects deeply felt as damaging to their values. no easing of pressure due to constant emotional, spiritual pain, emotional impacts, guilt, feeling used. So these were the common areas related to this theme of moral injury and relentless. So when I was looking at really wanting to get involved with Daniel's, I thought, boy, we have this study out there with our nurses in the community. As a nurse myself, as a retired Army officer, I looked at this from a perspective of really how can we help those immediately that we work with. So I work with a lot of my colleagues, my nursing students. Can I extend that a little bit further into the community? Can I extend that even a little bit further by bringing these results of this study to share with individuals like yourself, and really take it from a perspective of how we look at ethical engagement as a professional obligation. So this is some more quotes. I'm not a hero. I went through moral injury because I was put in a situation that I could never win. So does that make me a hero? Does that make me stupid for going through that? It's a moral injury. You want to do better, and not hands are tied, and you can't. And we're not the ones that we are going to have to live with that. I think one of the hardest things was to watch like the broken spirit of the hospital that I was working for. I mean, my floor had 2 codes a night with like 44 patients. That's not good odds. It was just constant, like all over the hospital, and you just couldn't tell everybody. They had given up before they started. Things like watching the basic BLS skills fall apart, watching them just waiting until they could call it after the second round of epi. Like it was really, really hard because you could tell that they had just been inundated for so long. So when you're in the midst of feeling like this in a profession like nursing, how do you get into ethical engagement, even as part of your professional obligation? Because our code of conduct with the nursing, our scope of practice, our nursing license, all of that indicates that we should have that professional obligation. But how do we do that when we're surrounded by this? Okay. So again, ask yourself that professional obligation to engage in ethics in some fashion, in some type of fashion. And I put that in parentheses to indicate that it doesn't have to be something grandiose. It can be something that we can take little steps with. Okay. And that's what I want to show you in this presentation too. So then I thought, as we presented these studies around the country and over in Scotland, I kept thinking about how I could become an influencer in ethical engagement. So I teach nursing research, graduate nursing research and undergraduate nursing research. So I was thinking that after talking with some of my colleagues about the graduate level courses in our curriculum, I thought, well, I could probably change my course to look at a better way to deliver ethics and how we can really promote ethics engagement among nursing students, especially at the graduate level, for example. So this is what I did. I'm going to take you through. I'm going to take you through the two assignments that students have in the graduate course, and you'll get to see what they have to do, and you'll get to participate a little bit too in your thoughts. Okay, so the first thing is in my nursing 6120 nursing research class, we have what we call this Daniel Funds ethics assignment. So this is just a little snapshot of what they have to do. It's probably a little hard to read, but they had this assignment where they had to apply the principles-based ethics to a real life scenario. They're look through an article, the article information, the documents related to Daniel Fund's ethical principles, and then they looked at a video, which I'm going to show you guys, and I'm going to show you guys what they had to review, and I'm going to get your feedback too, and I'll share with you what the students said. But what I'm capturing right here is I just want to concentrate on the Daniel Fund's ethic principles and then the moral courage strategies. So we're asking students to give their feedback and really think about their clinical area, their practice, and apply these principles and looking at strategies. Okay, so I'm going to click on this. And I just want you guys to take a look at this. And this could be a video that is in your respective areas. It could be something that maybe you've encountered. So based on this, when I looked at the state of the nursing profession and the study that we did here in the community, and then looking at academia as an influencer of ethical engagement. So what happened was that students looked at this video. So then what they did is part of that assignment was to take the Daniels Fund Ethics Initiative principles and apply that to the video. So offering not only our own nursing code of ethics, but another set of principles to apply to a situation, such as with the video here. So I'll share a little bit of the results with you. And this is what the primary ones that they addressed. Okay, they addressed integrity, accountability, transparency, fairness, and respect. And you can see in the video that she took accountability for her actions, right? She didn't blame it on anybody else. And to me, that's like that form of integrity, that she's taking that integrity and she's applying accountability. This was a quote from one of the students in my class with their permission, reminding nurses to take accountability for their actions because it's the right thing to do, even if there are consequences. But that doesn't only just apply to our nursing profession. I think that applies across the board, right? In any profession that we're in. And we can see that within society, when we're engaging with society and our community, that this quote is very relevant to what we do. So I wanted to share that with you, that these were from the students. And then the other piece of that assignment had to do with moral courage. And this is what students said about moral courage. Periodic ethics training, we needed that hotline, that safe to tell, open door policy. These were those suggestions for it set with stakeholders, develop trust, use this code, which I really thought this was pretty cool. This is an acronym of courage, obligation, danger, and expression. Communication, promote moral courage, be honest and set an example. So that's what the students in my course expressed as taking moral courage. So what I'd like you to do is I have some little 3x5 cards here, and I'd like just for you to take a couple minutes and write down 3 moral courages that you could implement in your work. And just think about that from a perspective of what moral courage strategies would you like to implement? But think about that from a perspective of what moral courage strategies could you bring to your work environment that would help us, because it's all about helping and encouraging those strategies so that we can engage in ethics, right? I want to share with you, because we're getting close to our time here, so we can have some dialogue afterwards too. But the other part of this assignment for the graduate nursing students in this research class was to look at moral injury, moral distress, and moral courage an article. So I wanted them to be able to go out into the literature and really identify what this is all about, right? About the moral injury, moral distress, moral courage. And their assignment, one of their assignments that they had to do was sort of write this elevator statement to describe how nursing leadership could improve the work environment. Okay, and they just had to write about it, just like so they got in the elevator with leadership, they could give their two spiel, or they're selling the car or whatever, with a bank executive or whatever. Give their elevator statement about moral courage and moral injury. So I won't have you do this again. But I'll just show you, just kind of where things fall here. Where moral distress occurs when no one knows the right thing to do. There's these institutional constraints. We're talking about the institute, right? Playing a piece of that, it results in anger, frustration. A moral injury where we actually have damage to one's conscience, a psychological, social, and spiritual trauma. It results in stress, tension, disorder, burnout, depression. We have that true medical outcomes that or mental outcomes that come with that. And then the moral courage has to do with that mental, moral strength to, venture, preserve, and withstand danger. It's pulling those attributes. It's being persistent. It results in fairness, the quality, the team spirit, honesty, and what you describe as a successful outcome. Okay, within your work area. So this is what a student said about the elevator statement. Okay, nurses who are conscientious to display courageous actions, provide high quality care, and have a strong set of personal values, show a link between moral courage and this conscientious behavior. In general, nurses who likely display moral courage and speak out if there is a concern or question about an ethical incident are the nurses who have a strong commitment to the profession, value principles, display quality human characteristics, and are sensitive to other suffering, and who respect workplace policies and are compassionate in their overall abilities to care. So this was a comment, part of the assignment that a student allowed me to share. And I just highlighted some of those things that maybe we've talked about, or maybe give some more thought to, speaking out, setting those personal values. When we were having this discussion, I was thinking about all our entities. And, if we took a 10-mile radius around campus here, and we looked at all the different entities that come into play, eating places, gas stations or whatever, of how many of them really look at ethical codes with their employees, right? You can go does a gym have it where you're being ethical about using your little kiosk to get into the gym, but the second person behind you is sneaking in with you? Are you bringing somebody who's not paying that the guest fee, and they're coming in when the door opens, two of them come in, right? So all these pieces display human quality characteristics. So I really thought this was a great example from one of the students. And then what is your elevator statement? For sake of time, I want you to turn to those two, and just say a couple words to your neighbor about what would be 2 words that you would include in your elevator statement to your colleague next to you. So just turn to them and say, what would you say to promote moral courage in the elevator? If you have to talk to your dean or your manager at work or your coworker, what would you say? It comes to those characteristics, right? Those human values, being respectful, not stealing principle and so forth. So let me go through these real quick. Again, I ask you that question, right, about professional obligation to engage in ethics. And then this I just put up here because I feel like they're just what I have experienced over the years, both as my career in the military and then here, is that this moral resiliency of building a daily mental practice of where we're very conscientious, right? Like Maria said on the thing, is that we are very keen to what we're thinking about and what we're doing. We're attentive to that. Finding that buddy and taking action in the sense that, speaking about the ethical dilemmas that we fall into. I just leave you with this: moral courage is the most valuable and usually the most absent characteristic in one. So Here's some references.